Are you wondering what Herxing during Lyme disease is, how long it lasts, and what the signs and symptoms are? Today in this video, I will be answering some of those questions.
Sublime 77. My name is Regina Stoneham, and I'm a Lyme Warrior. Sublime 77.
Welcome to Sublime 77, your channel for Lyme disease awareness, education, inspiration, and a little bit about my life. My name is Regina Stoneham, and I'm a Lyme Warrior. If you're new here, consider subscribing to my channel. See? And hey, at any point during this video, feel free to check out the links below. Herxheimer reaction is a temporary worsening of the symptoms of Lyme disease. It occurs when the Lyme spirochete is being killed off by antibiotics. This creates more inflammation, making the symptoms worse. The important thing to know, the worsening of the symptoms do not indicate failure of treatment in question. A sign of Herxing means that healing is taking place. You're going through a healing crisis, and it's horrible. But if you have that in your mind, that you're going through a healing crisis and you're not dying, the important thing to note is to detox during your Herxing. Some of the ways to detox is 2 cups of Epsom salt for at least 20 minutes. That draws out the poisons. Also, drinking lemon water really helps. There are many other ways to detox, and you need to do your research on that to figure out what you feel comfortable with for the detoxing. How long does the Herxheimer usually last? There is 48 to 72 hours after initiating antibiotics, and it could last for weeks. It may reoccur every 4 weeks until treatment is complete. Eek. I don't like that. I don't like that at all. The way that your body reacts and how strong your immune system is to how often you're going to Herx. And also another thing is like how strong the antibiotics are, how many you're taking, the supplements. All of that takes into account until treatment is complete. What causes Herxing? Well, taking antibiotics can cause Herxing. Taking colloidal silver, taking certain supplements can cause Herxing. Anybody that is detoxing can Herx. How do you know if it's a Herx or if it's a drug interaction? I hear this question a whole lot. Somebody's taking Doxy and they start feeling horrible on the Doxy, and they say, I can't be on that anymore. How do you know if it's a Herxheimer reaction versus an actual allergic reaction to the drug? If you're being treated with Lyme, Herxing is a good sign. The bacteria is being killed off. On the other hand, drug interactions will be more like described in the manufacturer's papers. The drug allergy intolerance starts minutes to days after starting the medication. Some symptoms to look out for are swollen face, rapid heartbeat, weak pulse, low blood pressure, airway restriction, rash, hives or blisters, shock. Go to the hospital right away if you're having these symptoms, because that's not a Herxheimer reaction. That is a medication reaction. It's very important that you don't risk your life thinking that it's a Herxheimer reaction when it's an actual drug reaction. Okay, so we're going to talk about the symptoms of Herxheimer reaction. They're like a magnification of your Lyme symptoms that you have already. You can also get some new symptoms while having a Herxheimer reaction. Some of the symptoms may include a bad headache, itching in your throat and in your ears, numbness and tingling in the extremities, sweating, Your heart could be like beating kind of hard, brain fog, neck and shoulder pain, like bad neck pain and shoulder pain, flu-like symptoms, really bad flu-like symptoms, chills, joint and muscle pains, stiff joints, sore throat, you can't get out of bed, fever, nausea, dizziness, vertigo, rashes, upset stomach, sometimes constipation, and sometimes diarrhea. Yes, I have to say those symptoms. And sometimes you have neurological symptoms, such as seizures. You also can get ringing in your ears, wheezing, acne, shaking and tremors, muscle spasms, muscle twitching, rambling when you're talking, like talking on and on and on and on and on and just kind of trying to get to the point, but you can't really remember what it is, so you just keep talking and talking and talking. Anxiety. OMG, anxiety, like social anxiety, just general anxiety, anxiety when you're alone, anxiety when you're with other people, just anxiety. Your body is in shock and it's hurting and it's feeling horrible. You're gonna be afraid and you're gonna have anxiety. Swelling, flushing, changes in your vision, severe pain, and extreme muscle fatigue and weakness. I know these are a lot of symptoms, but you need to hear them, okay? Environmental overload. Lights, sound, smells, and colors. When you walk outside, the light's too bright, you can't handle it. Sounds are too loud, you can't handle it. It's just like environmental overload, you can't handle it. The sights and the sounds, and then you smell something, you want to barf. It's just horrible. It's just too much going on. Horrible memory. Another one is you can't sleep at night, but you can sleep during the day, but you can't sleep at night. That's weird. A feeling like you can't breathe, like something is just wrapping around your chest. Almost like you feel like you have this, I don't know, this really tight band around your chest. Hyperventilating. I've done that a few times. Hyperventilated, so I was freaking out. You're still tired after you're sleeping, so you could sleep for like 16 hours and you wake up and you're still exhausted. And it's frustrating. You can have weight loss or you can have weight gain. Also, the last symptom, I'm going to be doing another video on this in more detail, is the psychological symptoms. The psychological symptoms are huge and they range from anxiety to depression. Those symptoms are very important, and they're something that we all need to watch out for in Lyme disease patients. If you know somebody with Lyme, please support them. Please be there for them and help them get through this. Sometimes just listening and not giving any input whatsoever, just being present with them will help them out so much. And sometimes, brainstorming and figuring out what to do and how to handle the symptoms of Herxheimer reaction together makes that person feel a whole lot better. But it just depends on the person. But just know that the Herxheimer reaction does not last forever. You may feel like you're going to die. You may feel like it's never going to end. But just know that there is a light at the end of the tunnel and that you're gonna get out of this, that you're gonna be okay. And yes, if you're still in treatment, it's probably gonna happen again. But be prepared. Prepare yourself for another Herxheimer reaction. Use the time that you're feeling better to prepare yourself. So, for instance, if you are going to be in bed during your Herxheimer reaction, get your bed set up to be comfortable for you. Get some comfortable pillows, get a really soft cover, get some kind of entertainment, get books, get your drawing stuff nearby. If you're a writer, write. If you're a crochet, you know, if you're a crocheter, crochet. Just get that set up. Get it ready for the next Herx. When the Herx hits, it hits hard, and you're just in bed. So get your, you know, have your special cup next to the side of your bed. Have your lip gloss or your chapstick or whatever makes you feel good. Your Tiger Balm, your essential oils, your pillow spray, anything that's gonna make you feel better during your Herxing to get you through this. So make that a priority when you're starting to feel better, to prepare for that. So when you are Herxing, you've taken steps to feel better, to make yourself feel better in the long run. And then also prepare those around you and tell them, say, okay, so when I'm Herxing, this is what I need from you. And it could be something as simple as, I need you to make sure that my cup of water is filled up when I'm Herxing. Something that simple. Or I really need the room to be very dark and quiet while I'm Herxing. Or I don't know, just communicate with the people that are around you, that love you, that are helping, taking care of you, and let them know what you need so that they don't have to guess on what you want or what you need. That's my advice to you. That's what I do, and it really, really helps. It helps so much. I just wanted to thank you so much for watching this video. The question of the day is, what do you do to feel better when you're Herxing? Do you have any tips to get through it? Let me know in the comments down below. Some of our best comments and tips come from the Sublime 77 community. If you like what you saw, please subscribe to my channel. Also, give it a like and leave a comment down below. I'm getting through this pretty fast. Pretty darn fast. Pretty darn fast. Pretty darn fast. The question of the day is, have you ever Herxed? I'm sure you have. If not, get ready. Bye. Wow.